Hello, everybody, and welcome to another episode of the Thriving Adoptees podcast. So today we've not got just one guest as usual, not two guests as usual, but three guests. So we have Elaine, who is a professor of pediatrics, and she's been working with a couple of adoptees over the last year or so, looking at the issue of advocating for our own health. So welcome to the show, Elaine, Ramya and Julia. So perhaps, I connected with Elaine back in March, and we were talking about this advocacy project, and we thought, well, because Elaine's a professor, what she was very keen to do is to bring in the lived experiences of the two adoptees that were involved in the project, and they're coming up with an article which links, as always, listeners, links in the show notes. So it's been a while so that we could coordinate lots of diaries here together, and that's why Julia and Ramya are on board. So it's all about, we came up with this title of advocating for our own health, advocating for our health and navigating that stuff. So perhaps can you just tee this up, Elaine, and then we'll move on to Julia and Ramya and just dig into it a bit deeper.
Sure. Thanks, Simon, and thanks for inviting us to join on your podcast today. I've been working in the field of adoption for almost 30 years and have provided pre-adoption consultation, comprehensive post-adoption screening, and ongoing primary care for children who are adopted, children who are adopted domestically, children who are adopted from foster care, children who are adopted internationally, and providing care for those children and their families for many, many years. And as many of your listeners know, at least in the international side, those children who were first adopted in the early 90s when China and the Eastern European countries opened their doors have come of age. So we have at least a generation, and for some of those children adopted earlier from countries like South Korea, had been adopted, having children adopted for many, many years. We have many now young adults and adults who have the lived experience of growing up as adoptees in the United States. And one of the things that I've discovered through my practice, as children become teenagers and then they become young adults, they begin to, of course, become independent people, which means many different things. And in my line of work, they become their own independent people in terms of their medical care and their health history. And I've started to think about what that means for these individuals. And in my own experience as a practitioner, I know what it's like, but I don't know what it's like to be one of these individuals. And I came across Julia and Ramya through some of my other colleagues who work in adoption and in advocating for adult adoptees. And they have their own personal lived experience in navigating the healthcare system with their families, and they can tell you much more about that. And together, we wrote this piece for the Adoption Advocate, and I think it's an important and an exciting thing to talk about. So, yeah. Thanks for having us.
You're totally welcome. It's a little bit different, listeners, as you'll be aware, but we want to kind of broaden the way that we support you, the listener, on the podcast, and always looking for new ideas, new topics to address, and basically also to keep me on my toes, doing new stuff, right? So perhaps we could start with you, Julia. So you were adopted from China, I believe, from looking at your bio. Can you tell us a little bit about your story and how come you got involved with Elaine and this piece?
Yeah, of course. Yes, so I was adopted from China. I was about 6 months old, and then my family had gone back and we adopted my sister, who's not biologically related to me, and she was about 9 months old when we adopted her. And I grew up in Massachusetts in a very small farm town area in the Northeast. And I am currently a medical student, and I'm in my last year, which is scary but exciting. And, you know, as an adopted person and a early career physician, a student, I noticed that there wasn't a lot of space for talking about non-traditional type families, including people who are adopted. And from my own experiences going to the doctor, where I'll say I'm adopted, and then it kind of gets silent and awkward. And versus when I'm in school and we learn about the impact of different genders and different races and all of these other identities and how it can impact someone's health and well-being, but we never talk about how people's family structures can impact it. I thought it was really strange and surprising and frustrating. So I had connected with Dr. Schulte, and then she connected me with Ramya, and we kind of all discussed through our personal experiences and experiences from different adopted people that we've read about and the other research we've done to try and compile this, perspectives piece amplifying this, the needs of adopted patients.
Yeah. So can you, perhaps we go on to you now, Ramya. So if I remember rightly, you were adopted from India, is that right? Or is it?
Yes.
Yeah.
Yes, I was adopted from India in 1995, and my parents had adopted my older sister. She was adopted domestically, and I grew up in a pretty, I would say, very conservative white Christian world, high school community. And so a lot of my work now is navigating my experiences as a transracial adoptee, kind of advocating for the needs of transracial adoptees and equipping and sustaining parents on their adoption journey. And I've done a lot of work with the National Council for Adoption. So I was connected to Julia and Elaine for the piece that we wrote through the National Council.
So there's going to be links to Ramya's website on the show notes as well, listeners, because as she says, she's doing some really important work supporting adoptive parents through different partners, different adoption agencies. Some podcasters, adoptee podcasters, don't go near this stuff. I believe that, why wouldn't we? Why wouldn't we share our lived experience? Why wouldn't we partner with agencies and support their parents? I think it's the whole show is about sharing the benefits of our experience in case, right? We're not saying that we know better. We're just saying that we have some lived experience. We'd like to share that lived experience, and we hope that lived experience helps some others. So perhaps I can go back to you, Julia, and talk about your own learnings. And really what we're trying to do here is help. So if I just take a step back, a lot of the purpose of the research was to get this issue on the agendas within the healthcare institutions, right? And kind of pull them, let's help educate them. Given that we're talking to adoptees here, adult adoptees, what can you share, Julia, that could help from what you've learned to help empower the adult adoptees listening to be better self-advocates? Because as Elaine's saying, when you're a kid or a teen, then it's a different dynamic to being an adult adoptee.
Yeah. I think from, like I was mentioning before, my perspective as a student, from what I've learned, it's not that providers don't want to support their patients, especially those who are adopted. It's just that they really don't know how to do it. And even being an adopted person myself, I didn't feel comfortable making recommendations for a whole community because I don't know what's right and what everyone needs. So I think that it's a two-way street where, hopefully patients will feel comfortable working with their providers to advocate for what they need and disclosing that they're adopted, but also at the same time, it's up to the providers to help initiate that conversation as well. So I think there's not, I wish I could give you one answer that could fix the problem, but unfortunately, I think it's going to take a lot of change from the institutional side and provider side, as well as just adopted patients advocating and being part of these kind of community advocacy organizations or on an individual level to raise awareness so that people start being, at the very least, saying like, oh, this is something I never thought about before, and maybe I should do something different or look more into this. Yeah,
because I know in the US that the insurance, the health insurance providers are a big factor, a big player, a big stakeholder in within the sector. Have you done any engagement work with the insurance providers, or has it been more about focusing on the institutions?
Yeah, I don't think the insurance providers are our primary target.
No. Okay.
I think we need to really target the folks who are actually providing the direct patient care.
Okay. Thank you. Yeah. So, Ramya, what sort of, how would you answer that question in terms of like your personal, and obviously just share as much as you want or not. We're not here to pry. What would you describe as your own take on this and your own learnings as an individual?
Yeah, I agree with everything Julia said. I don't think there's a one-size-fits-all approach. We want to empower adoptees and adopted individuals to feel that they can advocate for themselves, but we also want their medical providers to be able to lean in and get curious and be able to navigate all of that with care and tact. It was actually really interesting because about a little over a month ago, I went to the doctor to get blood work done again, and I hadn't shared that I was adopted, and I did, and he made a comment. It was something along the lines of, you must really want to know your real parents because blood is thicker than water.
Wow.
And I actually shared it on my Instagram story and tagged the publication that we wrote for the National Council for Adoption, because it was just wild that I had that experience after writing this publication. And I did share with him how the comment made me feel, and blood is not thicker than water, and that's not something you say. But it was hard because in that moment I was like, I don't want to be the one that has to educate you on this. But I also know that there is a responsibility that when I speak up, people, like, maybe this won't happen again to another adopted individual. And he's been in practicing medicine. He's a white male that's probably been practicing for 30 to 40 years, and he doesn't know what he doesn't know. And so I extend grace and want to give gracious assumptions, but there's also change that needs to happen in the medical setting so that adoptees feel like we don't owe our story, and situations like that don't happen.
Yeah. Because as you say, they don't know what they don't know. We just have to keep on pushing the agenda slowly forward. I put something on my socials today. I can't remember what was the something kind of sums that up. What was it I said? Should be able to remember my own stuff, but essentially it was about we're using a megaphone, right? Our adoptees' voices have been kind of marginalized or left out for so long that it's natural for us to shout, but we've got to be patient. We've got to be persistent, And we can't really kind of put our own well-being on hold whilst we wait for the world to change. We need to advocate from that level-headed space that you're talking about, and move it on. I hear a lot about advocacy in public settings here in the UK. This was a transracial adoptee who was born in Africa, and she said that if we go anywhere near this advocacy space in a political setting, and we show any anger, then this is UK politicians, they'll just ignore us. They'll just ignore us, and so it's all right. This Joy, she's been on the podcast before. She was saying it's kind of like it's okay for the politicians to argue amongst themselves and get angry amongst themselves, but if we're on the outside as adoptees trying to get our rights and we show any anger at all, we just get ignored. So there's that the grounding in the level-headed space is where we need to be to get what we create the change that we want. How do you see that? How do you see that kind of where we're coming from, that emotional space? Perhaps we'll go back to Julia for this, and then we maybe go back to Ramya. How would you see that? You know, traditionally these. And it may be a different thing, right? Because I'm an old guy at 56. You're younger, different generationally. How do you see that? Well, we call it white. In the UK, we call it white coat syndrome. So we're fearful of doctors. There's a power imbalance. Anyway, for my generation, or people within my generation, maybe it's slightly different for yours. But how would you set that? How would you see that?
Yeah, in terms of, is your question like if you should, how you should approach those conversations, or if you should incorporate emotion into it, or?
I guess I'm scrabbling for my own question. I mean, how do you see? Is it different generationally? Is your generation less? Are you more robust in kinds of holding people to account than my generation? How do you see that?
Yeah, you know, I can't speak for the whole generation.
Of course.
I think that I think the up and coming younger folks are very passionate about many different social causes, and emotion is very influential and passion is very influential. So you know, do I think that everyone's more outspoken than the generations before us? I don't know, but I think that in general in the US there seems to be a lot of encouragement for people standing up for what they need and what they believe in, which I think overall is a good thing. And holding people accountable to change, I think, you know, is also a good thing that many younger folks feel strongly about. In terms of the one-on-one advocacy between a patient and provider, I think, you know, holding your provider accountable can sometimes just look like saying, hey, I want to let you know that I'm adopted and it's something important to me. And, you know, I would hope that the provider would listen to that and ask them if they don't know and they haven't worked with adopted patients before, what they can do to help facilitate their health and the relationship between the two. And, you know, but at the same time, like Ramya was mentioning, it doesn't always have to fall on the person to do that. And that's okay too. And then if you look at a larger advocacy from like an institutional or political advocacy change, like you were mentioning before, having your representatives and your Congress people listening to you, I think those are appropriate times that people kind of get more fired up and maybe use their emotional experiences. But I don't think it's always you have to do it that way, because that might mean making the individual person feel uncomfortable sharing things they don't want to. So I think either way can spark change. But the most important thing is trying to do something, whether that means preserving yourself in the moment, or and just taking care of your own well-being, or speaking up and saying, like Ramya was saying, hey, this made me feel uncomfortable the way you said this, or hey, institutions need to change the way they care for adopted people. This isn't right.
Yeah. So Ramya, I think you used the word grace. Did you use the word grace? Can you explain a little bit more about, shall we say, a graceful approach to advocating for our health? How do you see that?
Yeah, I did use the word grace. Brene Brown talks a lot about generous assumptions and gracious assumptions, and she's one of my favorite authors. And I really just
we've lost Ramya's frozen. So yeah, she was talking about Brene Brown. I've literally just watched the TED Talk that Brene Brown did, because it's about the one I watched, I think, was about vulnerability, and giving people grace. I think is in the moment it's tough. In some moments in healthcare settings, it's tough. I remember about 6 years ago, exactly 6 years ago, my father had a terminal diagnosis with cancer, and the hospital wasn't doing what it needed to do, and that communication was really poor. And I was getting very frustrated about this. And then I realized that I was actually making the situation worse in my own head. So once I'd realized that, I wasn't being graceful, which is one of the reasons I asked Ramya about grace. Anyway, she's back online, but there's a self-awareness. For me, it was a learning moment, following my frustration and my lack of grace. After a couple of weeks of frustration building and building, something within me tipped, and I got that self-awareness piece landed on me, and I thought, I'm winding myself up here, and I need to be more graceful with the healthcare professionals. So that was just a filler whilst Ramya came on board, because we lost you. You froze, Ramya. So yeah, this grace thing. Can you share a little bit more about that? And Brene Brown, you were talking about.
Yeah, sorry about that. I'm not sure what happened. Yeah, so I was just talking about the generous assumptions, which is assuming that people are doing the best they can. And I think, kind of like Julia mentioned, there's a delicate balance between holding people accountable and also assuming that they're doing the best they can. And so I think I'm just trying to navigate that space of advocating for myself and advocating for other adoptees, and holding institutions accountable to the language they use and the way they speak, and what adoptees experience in the healthcare environment, while also understanding that most of the time people are doing the best they can.
Yeah. And
if I could just make a reflection on that comment, Ramya, because I think it's very interesting in healthcare. In 2023, those of us who provide healthcare are becoming much more accustomed to patients speaking up and asking questions, or sharing their opinions more freely than, say 20 years ago, when the doctor was the all-knowing expert and people just did what they were told. So whether the patient is coming from a background of adoption, or some other different constellation of a family that is much more common nowadays, or have different religious or cultural views or practices, healthcare providers are more accustomed to folks speaking up. So for your listeners, I would encourage you to be brave and speak up, because your healthcare provider is probably accustomed, not that you want to challenge, but you want to share what you're comfortable. If there's something that the healthcare provider is missing, if they have the blinders on, if they're not deeply listening to what you need, they're used to people speaking up now, much more so.
Yeah, brilliant. Are there any kind of, I know a lot of people listening to podcasts are looking for that the practical stuff, right? The how-tos. And clearly we're not really going down that line most of the time with the podcast. But does anything come to mind in terms of practical insights on advocacy, as well as the kind of the more bigger picture emotional stuff that we've been talking about? Does anything come to mind? So it's a tricky one, isn't it? It's a tricky one, because I mean, I was thinking about policy, asking them questions about policies, or do they, you know, like, so it's I'm thinking of advocacy from a completely different angle here. And, you know, like, so I used to do a lot of work in elementary schools, and you know, one of the and then some of the work was around bullying. So you'd say, right, you'd be calling the institution to account, the school to account, by asking them to supply details of the anti-bullying policy and stuff like that. I mean, so that is a practical things that we can do. And I'm just wondering whether that example gives you anything else in terms of some practical stuff, in terms of, I don't know, following up verbal stuff with emails, and I'm still grasping for answers to my question, but maybe I'm off track.
You know, I guess I would ask Julia or Ramya to think about maybe and everybody's experience is different, and your relationship with your healthcare provider is different. And, you know, we're talking about times when you might be seeing a healthcare provider that you know and that you trust, versus a time when you walk into an urgent care center and, you know, people ask some inappropriate questions, and how would you address the questions then versus with someone that you know and trust? I think they're different, and I'm not sure there's any specific tip. I always find, just in general, a sort of an approach of inquiry advocacy in a feedback model, depending on, again, your level of comfort. And again, I don't want to put words in anybody's mouth. You could certainly ask the provider if there's a comment that's made that seems inappropriate, what's their background or understanding about people who are adopted. Ask first and then tell. And you might tell with a question, something like, may I offer a suggestion? Or would you be willing to learn a little more? And again, you have to be comfortable with the person in order to say those sorts of things. So again, this is not a practical tip. This is a consideration that folks might want to reflect on a little bit. I don't know. What do you guys think about that?
Sorry. Well, I agree that there is I think getting curious is really helpful. I think for me, I've had to learn that at the end of the day, I'm my best advocate. And there are times it does feel really hard to stand up for myself, or to feel like I'm obligated to share my story with people that maybe I don't feel comfortable sharing it with. But there is a level of having to step up and get curious and lean in and choose to stand up for yourself and to ask for what you need. And unfortunately, it's a shared partnership and responsibility for the provider and then for the adoptee. And so I think both people coming in is how change happens, and how we empower adopted individuals in these spaces.
I think too, you know, a good model that I've learned, if someone has said something that's hurtful and maybe you're not feeling the most brave in the moment, but you want to say something, it's the ouch, oops model. I don't know if anyone's ever heard of that, but it's when someone says something and, you know, the idea is you can say something like ouch, like, or just like hopefully in a small way indicate, and the idea back would be that someone at least recognizes that they make a mistake. And I've done this once or twice, and it's actually pretty a very small, quick way to be like, oh, that was hurtful. And, you know, in return, at the very least, they can be like, oops, like I just made a mistake.
Yeah. Can you, Julie, you were talking before we hit the record button about this patient experience survey that you're working on. So can you tell us a little bit more about that? Because we want to encourage listeners. Again, there'll be a link to the survey in the show notes. So can you tell us a little bit more about that?
Yeah, of course. So this is a project I'm working on with Elaine, as well as another student who's adopted at UMass and a faculty member at UMass Medical School. And so along with doing some of this adoption advocacy work, I'm really interested in public policy change, and I do a lot of public policy advocacy for other topics. And I wanted to do a lot of it with adoption, but what I've found is there's not a lot of data to and numbers essentially to really show people how impactful and what the challenges are that adopted people face. There's a lot of anecdotal stories, there's a lot of studies with a small population, but in truth, to make political change, a lot of times numbers speak really loudly, and trying to understand what a community needs, it's really important to have studies. So this is a survey. It takes about 10 minutes, maybe 15, and it really just asks about adults, adopted patients' experience in healthcare. And it's specific to people who were adopted into families who reside in the US and have received most of their healthcare in the US. But the hope is to use the results of the study to you know, raise awareness about what some of these challenges are that people are facing, and make some change in either healthcare practice among providers, or public policy change if there needs to be changes among insurance. If adopted patients, you know, we find that they're not getting coverage for certain things that they need. So yeah, we're hoping that participants will get involved.
So we're going to be linking to that in the show notes, as I mentioned, listeners. And if you could share that with your on your socials, or with people that you know that would be interested in completing it. Is there any? I'm conscious of time and hard deadlines. Is there anything that I've not asked you about that you'd like to share, and any of the guests? No, I think we've covered it off. So thank you very much. It's been good talking to you all, and thank you, listeners. I hope you've enjoyed and found something useful in this episode. As I say, trying to do new stuff, support you adoptees in different ways, and we will speak to you all very soon. Thanks a lot, listeners, and goodbye.